And that's absolutely true, Charlie, because this virus has hit everybody now, hasn't it? I mean, as it's gone on, as the year's gone on, we all now know people who've been directly impacted by this. The overwhelming feeling you get out of this room is relief. Relief and joy. So people who are vaccinated here sit here, they sit here waiting to go home, and you can feel the relief. It is extraordinary.
Well, Graham, we're going to be with you throughout the morning this morning, so thank you very much.
It's interesting hearing Graham talk about that feeling of joy and relief.
Yeah, the emotions, it is an emotional thing, isn't it?
And especially for vulnerable people in those categories, vulnerable people as well, who have been isolated, you know, and not felt as if they're part of society and been so careful and fearful. And we can talk to our GP of the morning, Dr. Fari Ahmad. A morning to you. Interesting, isn't it? I mean, you must have seen people now who've had their vaccinations or who are just about to have their vaccinations, and just that palpable sense of relief.
Yes, I think certainly when we did our first vaccination clinic, we had quite a few over 90s who came. And it was actually quite an emotional day. For some of them hadn't been out, you know, for months, and you know they were a bit unsteady. But they said, "Look, I'm coming to get this because I know this will make a difference." So it was actually very moving just to see their palpable sense of relief at getting the jab.
So 10 million, that's the milestone that's been passed. I mean, you've been part of this for a long time in terms of vaccinating and trying to figure out how to do it. What does that number mean to you?
It's great. It's it's a real sense of achievement. I think this is one part of the response to the pandemic that I think we're getting right. And I think, you know, all credit to all the people who've worked to get this there, you know, the scientists who made the vaccine, you know, the people who are arranging for it to go all over the country, you know, the GPs and the other pharmacists and other people who are getting it into people's arms, and all the people turning up to have the vaccine. So, yeah, I think excellent team effort there.
You know, anecdotally, one of the things I think quite a few people are noticing is that they're not getting as many colds, perhaps, and flu levels are down because of the social distancing, wearing masks, etc. Have you noticed that different in terms of flu season?
Yeah, so certainly I think we've seen fewer cases of flu. What's interesting is around about this time of year, we often see, you know, the winter vomiting disease. We see breakouts of that, but we've not seen as much this year, certainly. And I think, you know, some of that is because people are doing more hand washing and they're keeping their distance from people. So, you know, we can see an impact on other diseases as well, the way we're living at the moment.
It is World Cancer Day today. Feels odd almost to say that because we just seem to talk about the pandemic all the time. There has been real concern, hasn't there, about delays in terms of emergency cancer treatment or urgent cancer treatment. What are you seeing? I mean, you've been very consistent when we've spoken to you throughout the past year in light of the pandemic about people having to, you know, do talk to your GP or do report any any abnormal signs you may recognise in the body.
Yeah. So, you know, I think it's hard enough having cancer and having to go through a diagnosis and treatment, but I think in a pandemic year, it's become even harder. I think there has been an effort to try and keep, you know, the cancer services open despite the pandemic, but I know in places that has struggled just because of the sheer numbers of people that the hospital was looking after. So, you know, as GPs, we've certainly, you know, we've seen the anxiety with people struggling to get tests, to get a diagnosis, and then people who have a diagnosis, you know, the anxiety about waiting for the op, you know, the worry that would it then just be cancelled, and then treatment, and, you know, being able to access services that would normally be there. So I think this year, you know, it's been difficult for a lot of people with cancer.
Yeah, it certainly can, I can imagine. Also, what people are dealing with is working from home, changing the amount of interaction they have. You know, one of the joys of being able to go into the office is actually, you know, just having a chat about stuff that's not at home. If you're not able to do that, you must be now seeing the impact of people when they do come into you, that how that loneliness has affected them emotionally and mentally.
Yeah, so I think, you know, us and you know, I think most GPs all over the country are seeing an increasing mental health burden that people are facing, you know, from the pandemic. Certainly from working from home as well has brought its own struggles and issues. So we're, I think I was reflecting with another colleague the other day that about 60, 70% of my consultations have an element of mental health, and it's certainly different to how it was, probably about a year ago. And this is the impact of, home working, home education, and just being in lockdown.
Can I just go back to the vaccination programme, Dr. Fari? Obviously, we've hit that 10 million mark. The ambition is to reach around 15 million by the middle of February, by the 15th of February. Is there extra pressure on you? Are you seeing in kind of the community, in terms of delivering the vaccine to reach that target, or has it been pretty steady and consistent in terms of administration?
So I think, vaccination is something GPs are good at. We've been doing, certainly doing lots of these for a lot. So we're happy to do it, and we're happy to get going with it. The issues we've been facing is the supply of vaccines. So certainly in the Northwest, I know our supply was cut down because we were doing too well, so you can't have that. And that's one of the issues. And so I know probably a week in advance what I'm getting, but I can't plan beyond that. And it would be really good, I think us, like a lot of other places, would be happy to help and get this vaccination program going, and so we can hit our targets. But it's just having access to, knowing that we're going to get these deliveries, so we can talk to our patients and say, yes, this is when you're coming in, this is when I know the vaccine's going to be here. That would be helpful.
Are you well? Just want to check in.
Yes, I'm well. Busy, but I'm well, thank you.
Good, I'm pleased. Okay, you take care of yourself, Dr. Fari Ahmad. Always nice to talk to you. Thank you. It's good to check in.
Yeah, it's always nice to do a welfare check.
Yes,
always worth.
I think so.
Do you know, I was just actually reading up as you were talking there. Interesting, you asked that question. Are you well? A little later on, we're going to be talking to Dr. Alex George, who is the newly appointed Youth Mental Health Ambassador. So he'll be advising the government.
Yeah.
And I've heard him talking already, and one of those really basic things about saying, you okay?
Yeah.
Those little bits of life. Do you know what I mean, Mike? It's just those little moments where someone could say something and catch someone at the right time and talk.
Yeah,
It's
absolutely, very important.
If you ask it, the automatic reaction is, yeah, fine, how are you?
I was going to say this.
Go on.
Yeah, no, absolutely. How often do we maybe feeling a bit headachy or something wrong, and you just say, oh yeah, fine? That's stock response, isn't it? I think maybe during the pandemic that people are getting more honest, and if they are actually feeling
twice.
Yeah, ask twice, and if they are feeling a bit rubbish, just say.
Yeah.
And then you can talk about it.
There are bigger things to worry about, but it's great that you can have emotions when we can watch sport.
And contrasting emotions.
Yes.
Surge at Brighton.